And now we have this report from Laura Windsor.
When injury, disease, or trauma affects one or both of your hands, certified hand therapists like Jan Horton of St. Jude Medical Center in Fullerton can help patients regain movement and strength through specialized hand therapy.
In order to become a certified hand therapist, you have to have been an occupational or physical therapist for 5 years. And then in addition to that, you have had to have had demonstrated 4,000 hours of direct patient care with hand injuries. After that, then you're able to sit for the examination to prove that you know what you know and earn the title of a certified hand therapist. Now there's many people out there that treat hands that aren't certified hand therapists, but the certification assures you as the patient that you have somebody working with you that understands the biomechanics of the hand, the structures, the healing process, the disease process, or the surgical procedure, and that you will get the most specialized expedient care you possibly can. There won't be guesswork. Our patients come to us from a variety of different doctors, but also with a variety of different diagnoses. It can be cumulative trauma, such as carpal tunnel, lateral epicondylitis, and decurvains, to name a few. A traumatic injury, so if you fall and fracture or you cut yourself and you disrupt some of the tendons or nerves or just have a wound. Disease processes such as arthritis. Those are a lot of different diagnoses that would come under those headings. The first time they come in, they're given a thorough evaluation, and so we will measure their range of motion, determine their strength, do some testing to really pinpoint the diagnosis, make sure that it's what we've been told by the physician, and re-clarify that if we have to. We ask the patient about their goals and what they want to be able to attain. And then we determine a treatment plan along with them. What do they want to be able to do, and how fast do they want to go, and what kind of activities are they willing to participate in. At that point in time, we do a little bit of treatment to see how they respond quickly, and that gives us a better indication of their prognosis. And then we teach them a home program so that when they leave the clinic, they've either seen that they can make progress with what we're going to ask them to do, and then what can they do at home. One of our big goals is really not to treat patients every single week for the rest of their lives. We really want to get them independent on a home program. And so if we can, as soon as we can, we get them independent so they can continue. I also had a physician who was in a car accident, amazingly enough. He's a dermatologist in our health system. And when he first came to see me, he came in with a sore wrist. And they had done some x-rays, nothing was really all that clear. And as I was working with him, I looked at him and I said, you know, you have a carpal bone in there that's rocking and rolling that's not supposed to be. And I said, and there's a diagnosis, a VISI or a DISI. And I said, you have one of them, I'm not sure which one, but you need to go and get it checked out. So he went to another physician, and sure enough he did, and they were able to do wrist surgery, and he came back to me as a patient again after the surgery. And he is also back to performing dermatological surgeries. And I see him in town every once in a while and his kids, and he always tells my kids about how mean I was and about how wonderful it is, but he was a success story. What's really unique about our facility is that we have 7 certified hand therapists, 4 of which are occupational therapists and 3 of which are physical therapists. And the unique thing is not just the number, but the balance between physical and occupational therapists. We blend our hand therapists blend all of this knowledge of physical and occupational therapy into one specialty group. Because we have physical therapists and occupational therapists on staff, we can look at the whole picture and be able to provide the treatment in our clinic without having to refer outside.
Regaining the use of your hand or hands can allow you to get back to normal and independent again, and that's worth applauding. I'm Laura Windsor for the American Health Journal.